45 years old, managing director for a major firm, passed away of a heart ailment. As we climb that ladder, we're more likely to develop anxiety and depression.
You grow up in Detroit where we're the motor city and you think, I'm supposed to be in my car. You know, my friend said, this is crazy that you don't have a bike. And so they literally loaned me a $30 bike, and I fell in love with it.
Behavior change shouldn't be something you need to endure, because we change best by feeling good. If we change best by feeling bad and beating ourselves up, we would have already had the thing that we wanted.
Welcome back to the Metro on WDET. I'm Robin Vincent. More Americans are getting sick from preventable illnesses, especially kids. Here in Michigan, measles cases have recently been confirmed in Oakland, Macomb, and Kent counties. In Texas, 2 children have died from measles. Both were unvaccinated. Now, health experts say measles deaths could become more common, which would mark a real shift in the U.S. Measles was declared eradicated 25 years ago, thanks to what state officials describe as a highly effective vaccination program in the U.S., as well as better measles control across North, Central, and South America. But the landscape for infectious diseases is changing. Vaccine skepticism and hesitancy are on the rise. And the numbers bear that out. So far this year, over 600 confirmed measles cases have been reported across multiple states. Now, for comparison, there were 285 measles cases reported for all of 2024. What's really concerning is that outbreaks are on the rise. The vast majority of cases are outbreak-associated, which is defined as 3 or more related cases. Now, the backdrop is that the nation's hub for addressing infectious diseases, the Department of Health and Human Services, has faced major cuts under the Trump administration. Experts say those cuts could affect the response to infectious diseases at the local, state, and national level. To help us understand what's going on, Dr. Tina Chopra joins us now. She specializes in infectious diseases. She's a professor of medicine and assistant dean at Wayne State University's School of Medicine. Dr. Chopra, welcome back to the Metro.
Thank you, Robin. Thank you for having me.
So, Dr. Chopra, for many years, measles wasn't a health concern in the U.S., and so many of us aren't even that familiar with the illness. Could you first just talk about the disease?
Sure. Like you rightly pointed out, U.S. had received its eradication status long time ago, but now we are beginning to see upticks because childhood vaccination rates have fallen. And like you pointed out, measles is one of the most contagious diseases. It's a viral illness. And 90% of people who don't have any immunity with measles will become ill if they are exposed to the virus. And this highly contagious virus can live up to 2 hours in a space, in the airspace, after an infected person leaves the area. So not only is it highly contagious, but it can also lead to severe complications, which are more common in children. The vaccination program is highly effective. The vaccine is highly effective. So it's very important that children receive their vaccines. There are 2 doses of the vaccine that are required in children. And these new outbreaks we are seeing them because this childhood vaccination rates have fallen. Only 30% of children are actually getting their first dose on time.
Dr. Chopra, I'm sorry to interrupt you, but I'm wondering if we could dig into that a little more about why it's so important for parents to follow a vaccination schedule for their kids rather than, say, letting them get a little older and make the decision for themselves.
Yeah, that's a great question. So, the reason why the vaccines are given at this age is because the immune system, children they are not exposed to the virus, and babies are more vulnerable to diseases like measles or whooping cough or diphtheria because they don't have a strong immune system. So the way the immunization schedules are designed is to give them protection at an age when they are at most risk. Their immune system is still developing. And vaccines are basically helping to train their immune system to respond effectively. So that's why it's important that they receive the vaccines on time. Also, they do get some immunity from the mom if the mom is vaccinated during pregnancy. But that immunity wanes off after 6 to 8 months. That's why most vaccines are scheduled such that children can get it at a time to build up their immune system.
Can we stay on the MMR vaccine? It also, that stands for, so it's measles, mumps, and rubella. How long has this vaccine been around, and what can you tell us about those other illnesses, about mumps and rubella?
Sure. This vaccine has been around for a long time. In the 1960s, the vaccine has been, there are different kinds of vaccines that were given then. Now two doses are required. If somebody is vaccinated in the 80s, then only 1 dose is required for them. But after that, 2 doses are required in children. And the other viruses include mumps and rubella. Mumps is also a virus which can actually cause fever. It is less severe than measles, but it causes fever and swelling of the parotid glands, the salivary glands. And we have seen a case of measles as well in Michigan, and every year we see cases. But if the vaccination rates go down, then there can be uptick in the number of cases, and there can be outbreaks. And the third virus is rubella, which causes complications during pregnancy and can cause severe complications in utero, which can even be fatal for the child.
Now we know that Health Secretary Robert F. Kennedy Jr., who is known as a longtime vaccine skeptic, just endorsed the MMR vaccine. How important of a move was this? Do you think he's got the power to influence some vaccine hesitant folks?
Absolutely. I think leaders who are in this position have the power to help with misinformation, with vaccine hesitancy. And it's very important to promote vaccines, because vaccines, I think, are the critical part of public health. This week is Public Health Week. And with all the outbreaks that we are witnessing, I think it's very important for our leaders, not only leaders in power, but also leaders in the scientific community, to promote vaccines and to spread awareness.
Dr. Chopra, it's an uphill battle, though. I mean, we know vaccine efficacy is still on people's minds. I think about with the COVID-19 pandemic, vaccines for that. You could be vaccinated against COVID, but still contract the virus. But the vaccination meant that you're likely to have a less severe case of the disease, and you're also less likely to be hospitalized or, very crucially, to die from it. Is this similar with measles and some of the other infectious illnesses that are of concern to you right now? And does this make it harder to convince people to get vaccinated?
Absolutely. It is harder, especially when the workforce has been cut. As you know, HHS is responsible for funding programs that promote vaccine and educate the public and make vaccine supply chains. So that can further widen this gap, and with fewer educational campaigns, it can erode the public trust in the system. But I think as a community, it's a shared responsibility that we keep doing what is ethical for our society and what is the best for our children.
This is the Metro on WDET. I'm Robin Vincent. We're talking about the rise in infectious diseases like measles. Our guest is Dr. Tina Chopra. She's an epidemiologist, a professor of medicine, and an assistant dean at Wayne State University's School of Medicine. What other infectious diseases are on the rise right now, Dr. Chopra?
There's also an uptick of whooping cough. We do see some cases of whooping cough every year, but there is an uptick of whooping cough. There have been a few cases in the country, and there have been actually 2 deaths in Louisiana. And as you know, again, this is a childhood vaccination that can be given, and infants less than 1 year are at greatest risk of serious illness or death because their immune systems are still developing. And just for the context, there were 10 whooping cough deaths last year. So it isn't too unusual, but it is a preventable disease, and cases can be prevented.
Could you talk a little bit more about how you're trying to approach vaccine hesitancy and skepticism in your work?
Absolutely. I think as a team of scientists, researchers at Wayne State University, we have a Center for Emerging Infectious Diseases, and one of the goals of this center is to build trust in the scientific community and the healthcare system, ensuring everyone knows what vaccines are and knows facts about them and how we can debunk the myths around vaccines. So we have a program called the Vaccine Ambassador Program that Wayne State is leading, where we educate the Detroit youth around history of vaccines, around how they were discovered, and how we can best communicate them to their peers. And we are also starting a program for the school teachers who can help start programs in the schools. So these are some of the ways we are trying to protect our community's health.
That's interesting, Dr. Chopra. So instead of trying to reach parents, you're taking your message to kids instead. Talk a little bit more about that.
Sure. This is called the Train the Trainer session. So we train high school students throughout the year who are interested, particularly more in the summer. And we have built educational modules along with our School of Medicine medical students who help train these high school students. And once they are empowered, they go out in the community and they train their peers, whether it is the middle schoolers or they go to churches or they go to nursing homes and they talk about vaccines, not just one vaccine, all vaccines. So I think education coming from peer to peer is much more powerful. Also, the communication is much better.
So you feel that you've got more of a shot. Sorry, I couldn't help it. You've got more of a chance with young people, with reaching young people right now than parents, perhaps.
Absolutely.
Huh. I wonder if we can talk a little bit about how the cuts to the Department of Health and Human Services stand to affect local and state health departments. I mean, you mentioned this earlier. Is this something you're discussing with your colleagues right now? How concerned are you about this from the lens of infectious diseases and public health?
Yeah, I am extremely concerned. I think this is the backbone, this is the spine of public health, right? All these agencies, HHS, FDA, CDC, if there are major cuts, and including state and local health departments, they could widen health disparities, particularly in underserved communities like Detroit, where vaccine hesitancy is higher. So I think the way we are approaching it is we are feeling more responsible that what can we do at a local level? What can we as scientists do to provide clear evidence-based information about safety of vaccines, about public health in general?
Are you concerned that this could affect your work at Wayne State, these cuts, these federal cuts?
Absolutely. I think we are part of the community, and there is a trickle-down effect. Absolutely, it can affect what we do and how we do it.
And again, I mean, you work to address the longstanding mistrust that people have with the medical system, specifically people from vulnerable communities. I'm thinking about folks of color and low-income families. And so if you were to see cuts, then that, it sounds like, is going to have a ripple effect when it comes to vulnerable communities here in Metro Detroit. Is that right?
Absolutely. It can erode public trust in the system, in public health, So this is definitely highly concerning for all of us.
Before I let you go, are there any other novel ways right now that you're really trying to build some bridges and grow public trust when it comes to the medical system or when it comes to vaccines and public health?
I think the Vaccine Ambassador program really stands out, and we have been running it successfully for the past 3 years. And again, this summer, we are going to offer it to Detroit high schoolers. So this is something that we plan to continue doing.
Dr. Tina Chopra is an infectious disease specialist. She's a professor of medicine and an assistant dean at Wayne State University's School of Medicine. Thank you so much for joining us on the Metro, Dr. Chopra.
Thank you, Robin. Thank you for having me.
We cover a lot of topics on this show: the Metro, culture, government, climate, technology, health. What stories matter most to you? Let us know by leaving a voicemail. Just open the WDET mobile app and hit the open mic button. Tell us your name and what you want to hear from the Metro, your local news and culture program. Tomorrow on the Metro, have you seen your retirement savings tumble with the stock market? We'll talk with a financial advisor and take your calls. The Metro is produced by Sam Corey, Carrie Jr. II, and Jack Philbrandt. Our engineer is Nate Bender. Our senior producer is David Lyons. The Metro is a production of WDET, a listener-supported service of Wayne State University. This is WDET-FM, Detroit Public Radio, your connection to news, music, and conversation.